Thank you so much for hosting this meeting and this opportunity for us to hear more about what's happening in the Senate around prescription drug affordability. You will see a sea of red shirts here. This is all of our advocates and volunteers here at AARP. Data shows that across party lines, lowering prescription drug prices is a huge priority. And we know you've been a super solid champion around this issue and helping advance Medicare negotiation. So I'd really love to hear from you, about this work and the tremendous advocacy and leadership that you have provided.
Well, great. Well, Kathy, thank you so much. Hello to Washington State AARP. It's great to see all the red shirts out there and to have all of you join us. And I just want to thank you all for your amazing work, because really your advocacy for older Americans and for all our communities in Washington State is just really so critical. So I really want to thank you for that. And I'm really glad that we were able to get together today to talk about one of the most urgent and pressing crises in this country today, and that's, as Kathy said, the skyrocketing cost of prescription drugs. Every day I wake up and I try to think how I can make my life better for people that I represent from Washington State. And one of my top priorities right now is absolutely doing everything I can to lower the cost of prescription drugs. I don't have to tell any of you, for years now, drug costs have just been skyrocketing. Cost of insulin, as you know, has tripled in the last decade, but it hasn't gotten 3 times better. The price has just gotten 3 times more than it used to be. So it just doesn't make any sense anymore. And I think we all have this moral sense that this is just not right. So we really believe that Congress needs to step in and make things right. I have heard from people all over our state, from Seattle to Spokane, big communities, small communities, everyone, that they've worked hard, that they've played by the rules, they've saved their money, but they still are making impossible choices to afford the life-saving medicine that they need. And that's the same thing, is that life-saving medicine does not save any lives if people can't afford it. Every day, there are people in this country, probably some of all of you on this call today, who are knowing and wondering if you would be better off rationing a prescription or risking your life. And that's just not a choice anybody should have to make in our country. So we are working hard on this. I refuse to throw my hands up in the air and accept that this is a reality. So I'm working on a number of things and fighting to get 50 votes for these, as you know, that we live in a divided Senate, and we are working hard to get the votes we need. So I believe we need to bring down the drug costs. We need to crack down on pharmaceutical companies that are driving these prices up. And what that actually means is stopping companies from gaming the system and blocking cheaper generic drugs, as one thing. Finally, giving Medicare power to negotiate lower prices, permanently capping insulin at $35 a month for patients, and extending the relief that we already passed in the American Rescue Plan, which is saving millions of patients thousands of dollars on their healthcare premiums this year. And I'm really fighting hard to make sure we cap out-of-pocket drug costs for seniors. So I don't need to tell any of you all, this is so important for seniors who are on fixed incomes especially, but helping people solving problems, that's my job. And I work at it every single day. And I believe that we can really help people by putting money back in their pockets and taking a little stress off their shoulders. When families are seeing higher prices today at the gas station, at the grocery store, lowering costs for everything, for everyday things is really part of what we need to be doing to help us through this challenging time in our country. And lowering the cost for prescription drugs is one of the best ways we can do that and help fight inflation. So no, I am doing everything I can in this other Washington that I'm in right now, to get things done. And as I come home every weekend working to chat with so many people like all of you, so I can take the stories back here to this Washington to help continue to get the votes we need to get this done. So great to be on the call with all of you. And Kathy, I'll turn it back over to you for a conversation.
Thank you, Senator Murray. And again, we cannot agree more. Americans are fed up with paying, 3 times what people in other countries are paying for the same drugs. It's outrageous. And more than 4 million people across the country, and including here in Washington state, about 114,000 people have showed that they have your back as you champion this, this cause and this issue. They signed a petition, they're using their voice, they're out there raising awareness, sharing their stories. I had one story that was just shared recently by one of our members, John, who had said that he's now paying $500 a month for a heart murmur medication. So $500 a month, that's $6,000 a year that he, you know, could use for something else, to go travel, to see family, what have you. So it's really astounding when I hear these stories, and I'm sure it just shocks you as well. We do have a couple of our members on the call right now. At first, I'm going to turn over to Zelda Foxall. Zelda is an incredible advocate and champion for so many issues, and this is one that she wanted to ask you a question about specifically. Zelda?
Okay. Yes, Senator Murray, I appreciate the fact that in your opening remarks, you basically touched on the concern that I had, or the question that I had, and that was talking about the fact that we've seen for years drug prices just increasing, and they've over the past 15 years they've just dwarfed the highest general inflation that we have. And right now, if you know, consumer prices had kept up with the drug price increases, we probably today be paying $13 for a gallon of milk. And so by your opening remarks, I see that you covered that, our concerns with that. And my basic question was, how do you start to finally lower the drug prices and lower the out of cost for seniors with respect to the drug prices? And I know that, and you did say that.
I referenced that. Well,
yes.
I would, first of all, Zelda, thank you for your passion. I can hear it in your voice, and I so appreciate it. And I know you're speaking on behalf of so many people, so thanks for speaking out. I'll go back through that part of what I said again, because it is so important. A lot of people say, oh, I'm for lowering drug prices, but they aren't giving concrete proposals. I think it's important to specifically tell you what we are trying to do, because they will actually, if we can get them implemented, lower prices. Because as I said, life-saving medicine doesn't save any lives if people can't afford it. To me, that's sort of the guiding principle and my motivation every day. So we are, again, pushing for meaningful steps to bring down drug costs and crack down on pharmaceutical companies that are driving these prices up. So starting with stopping companies from gaming the system and blocking cheaper generic drugs, which is part of why you can't find cheaper generic drugs because they're being blocked. So we need to stop that gaming. Giving Medicare the power to negotiate lower prices. We've talked about this for a long time. The VA does this, and we need to give that ability to Medicare. One of the other things we're working that's very real right now is capping insulin costs at $35 a month for patients. And finally, extending the relief that we passed last year in the American Rescue Plan to give patients better access to lower healthcare premiums.
Great. And one other thing I just wanted to say, Senator Mary, that's great, because I have a friend of mine who is going to retire, or was hoping to retire, but she got a medical condition just recently, and the price of her medication is $3,000 a month, and that she's not going to be able to retire. And they've been working to find some generic drugs, but they haven't found one that works for her yet. So they're still looking. So thank you so much for looking into that. It's a real need.
Okay, thank you, Zelda.
So thank you again, Zelda, and thank you, Senator Murray. Candace, you have the next question.
Yes, hello, Senator Murray. I appreciate your input today. I really do. How will Medicare negotiating authority lower the cost of specialty drugs like those for MS, multiple sclerosis?
Well, thank you for asking about that. My dad had MS, as you might know, so I'm well aware of the challenges of that really difficult disease. And I'm going to hold for just a minute. We're in the middle of a series of votes, and I'm getting buzzed behind me, so I want you to be able to hear me. So hold on just a minute, it'll stop. Okay, that's my call to a vote, just so you know. The way that we are looking at this is the same way the VA does. When they bulk purchase, as with anything we know, you can get a large bulk purchase. You can drive the price down by buying it in bulk. Similar thing with how we would negotiate with to lower drug prices. Medicare is one of the biggest drug purchasers in the nation, and we want to use let it use its power of force to negotiate and bring drug companies to the table and negotiate lower prices for the highest cost drugs.
Thank you.
Great, Candace. That was an excellent question. There's a couple great questions that are coming in chat. I don't know if you want to address this one, but there was a question related to somebody saying that their drugs are under Medicare Part D, and that's why they're so supportive of this Medicare negotiation, are 2 to 3 times that of what they can actually pay through GoodRx, which is a free app, and wanted to know if that was also an issue. So sorry for that kind of left field question, but I thought it was very relevant to this conversation.
So I'm sorry, are they saying that they can get it under Medicare Part D cheaper or under GoodRx cheaper?
Under GoodRx cheaper.
Because GoodRx is using their bulk power to be able to negotiate a lower drug price, which makes the case for why we should be able to use Medicare to negotiate. That
is why we need to have Medicare negotiation.
Yeah.
So thank you very much for taking that. I just thought that was a really relevant question. So I wanted to also just, kind of have one final last question, because I know you have a very, very tight schedule. When can we expect to see action in the Senate? The House passed this, and what does that prescription drug package, what is it going to look like? What do you hope that the final package is going to look like? And will it definitely include the Medicare negotiation?
So as all of you know, we have been trying to pass what was originally called Build Back Better, which is a process we are using reconciliation because you need 50 votes rather than 60 votes to get it through the Senate. I don't think I have to describe for anybody the challenges we have had in getting 50 votes, but we are working right now to find out if there is a path forward to get 50 votes for some of the things that were particularly important in that bill. Lowering prescription drug costs through some of the means that I just talked about, others that the Finance Committee is looking at, are one of the key components that we believe if we can get a package moving and get it through, that we can include that. So that's what we're working on negotiating right now. I don't think I have to tell any of you that we need 2 of our members to agree to a package, and we are working hard to find a way to that path.
Well, thank you again for that, Senator Murray, and just for this, again, your time to talk about this really important issue, and not only just for older adults, but for the general population as well. And we know AARP has done extensive amounts of research on this issue, and one of the things that we're really think that there is a lot of ability to make this happen this year is that we have a survey of voters that, regardless of party, found that strong majorities of voters want Congress to act on the issue, with 70% saying it's very important. The survey also found that 87% of voters support allowing Medicare to negotiate prescription drug prices. So it just seems like now is the time to get this done. And I think we have a huge opportunity. So any final last remarks, any things that AARP can continue to do to help advance this?
Kathy, I really appreciate AARP and all of you for speaking up about this continually and telling us your stories, sharing your perspectives, being at our back as we work through these challenging, difficult times we have, to keep pushing us to make sure we get this done. I'm doing everything I can to make sure your voices are heard, but I'm also doing everything I can to get this package negotiated and get it through the Senate and to the president's desk. So I hope the next time we chat, we'll be celebrating a bill getting done.
All right.
Again, thank you so much, Amir.
Yep. Sorry, just to jump in, Senator, you do need to get to the vote. So thank you so much to the press on today's call. Apologies, we don't have time for press QA, but you know where to find us if you have any questions from this event. And I'll turn it back over to Kathy. And Kathy, our staff can also stay on if your members have questions.
I am going to jump off. I have to get to a vote so I don't miss it, but thank you all so much. I'm so honored to be your voice here. Thank you.
Thank
Take
you.
care.
Thank you again for your time.